Hello, everyone. We're going to talk about blindness and vision impairment this morning. The first thing I want you to know is that there's 3 different classifications of vision impairment. So you're going to see low vision first, and that's an inability to read small print, so they need to read larger print. They need to have special conditions like glasses in order to read, or have some kind of contacts or support system in order to read extremely large print or even regular print. The second classification is blindness. And what's interesting about blindness is you might think, oh, it's low vision and then blindness. But even with blindness, there's some light perception. So even someone who's diagnosed as blind might still have some peripheral vision. So they're able to see light out of their periphery or able to see some shadows out of their periphery. So blindness isn't total blindness. The last classification is total blindness, which is no light perception at all. I'm going to shut my door really quickly, my office door, so that you don't hear my dog cry. 1 second. All right, sorry about that. We're just having all kinds of fumbles this morning. All right, most individuals have slight vision, so it's very rare that I've ever worked with a child that has total blindness. Usually there's either light perception or some peripheral vision or some form of being able to see a little bit of something. I've never worked with a child that was diagnosed with total blindness. What's important is to see the level of their vision so we can support them. All right, so types of vision problems, you're gonna see physical abnormalities first. So this is the majority of true visual impairments because a lot of times the physical problems are what's causing the child to lose some of their vision. So these are problems actually with the eye, either functionally or some connections are lost. That's when you have those physical abnormalities. Visual acuity, I have visual acuity issues, so refractive errors, correctable with eyeglasses, nearsightedness, farsightedness. We're going to look at each of these in more detail. And then muscle problems. This is really interesting, and when we talk about how to correct muscle problems for vision loss, it's fascinating how we can actually strengthen the muscle within the eye that's experiencing muscle weakness, and it's better when we get to it at an early age because the muscles are more easily influenced by some of the interventions. Okay, so some examples of muscle problems are strabismus, so when the eyes are not aligned. I have some visuals of these on the next slide too, and amblyopia, which is more commonly known as a lazy eye. This is important. The person who works with and diagnoses a lot of these vision problems is called the pediatric ophthalmologist. And what's important about this is the word pediatric, because what does that imply? That their specialty is working with children. And there's a huge shortage of ophthalmologists who actually have a specialty of working with young children. In fact, when we get children under 3 years old that we need to refer for vision consults, a lot of ophthalmologists that don't have that pediatric in front of them will deny them and say they're too young to get assessed, which is not accurate at all. I think right now we have 2 ophthalmologists, pediatric ophthalmologists, between Manteca and Modesto. It's actually the same doctor, same practice, but just 2 different areas. And so he's contracted with other ophthalmologists to serve the young children in our community. So think about how long the wait list is to get in for just a consult. Definitely a needed area there. Okay, so let's go back to these physical abnormalities. A lot of these happen during gestation. Sorry, I forgot that hard word. Gestation, when a child is developing and growing inside their mother's body. One of the most common ones that I've worked with is actually ROP. And so what ROP is when a child is born extremely premature, especially my micropreemies, the eye doesn't completely develop. And so when they're born, all the attachments that are supposed to be there aren't fully there. And so it's almost like the eye has to continue to develop outside of the womb, which isn't ideal. And so you get a lot of children with vision loss, either complete vision loss or partial vision loss, and you start to see some of this glassy film over their eyes, and that's when you can tell that their vision has been affected. Okay. There's also some physical problems within the brain, and so some of these infections that can take place in gestation can also cause vision loss as well. Okay. All right. More physical abnormalities. So cortical blindness. I think I spoke to you all about the child I worked with who had been abused, had been shaken. And so when he was shaken, he actually had the alignment from his eyes to his brain were cut. And so when those are cut, he ended up with cortical blindness. So basically the connection from the eyes to the brain was severed, which is pretty scary to think about. So another problem we talked about was visual acuity problems. What's interesting about this is that a child's eyes are going to appear completely typical. When you look at them, you're not going to see any issues, which makes it so difficult to diagnose. But we're going to look at some of the behaviors that children exhibit to support us in seeing that there might be a possible vision impairment. Okay. So astigmatism. I have an astigmatism. A lot of people actually have astigmatisms. It's very easily corrected with eyeglasses. But really hard to diagnose in young children unless you get them to an ophthalmologist. These are fancy words for words you probably already know. Nearsighted and farsighted can also be referred to as myopia and hyperopia. Okay. All right. So here's these really neat muscular abnormalities. So what happens in your eyes is you have muscles behind them that are controlling them and allowing them to work in unison. So they're allowing them to turn to the right at the same time, to turn to the left at the same time. They're pulling in the direction that your brain is telling them to go. When there's some muscular abnormalities, there's either muscle weakness or a muscle tightening. So in strabismus, what you're seeing is the muscle is either pulling or it's weakening, and so the eye just automatically goes inward. So when you're seeing a child with strabismus, a lot of times you can infer that there's some muscle weakening behind there. Okay. With amblyopia, there's no difference. Excuse me, there's actually a lot of difference in visual acuity between the eyes, whereas strabismus results in repression of vision from the same eye, leading to blindness. So with strabismus, you see not only the muscle affected, but also some vision affected as well. Where amblyopia, the child's still able to see from that eye, but the acuity is not the same, if that makes sense. Nystagmus is actually something we check for really young. So some of the young babies I work with, a way to check for nystagmus is by tracking. And so you get something in front of them and you want the baby to follow whatever they're tracking with their eyes. When you see nystagmus, when they're tracking, all of a sudden their eyes will flutter. And so what that tells us is that there's something neurological that's happening that's causing their muscles to twitch. And so the referral for nystagmus is actually a neurologist. They need a neurological consult. Okay. Any questions so far? No? Okay, I'm gonna keep going. So how do you identify vision problems? We talked about how partial vision loss is really difficult to recognize in young children because they're not going to tell you, I see things differently or I can't see, because they don't know the difference. They think everyone is seeing like they're seeing. And so young children who can't talk or have little language or maybe can talk but don't know that there's anything wrong aren't going to be able to tell you that there's something wrong. Most of us are familiar with the illiterate E test. So what this is for young children, so they don't have to identify the letters, they can identify shapes instead. So for young children who are like in preschool and still working on letter identification, it's a shape identification instead to look at acuity. Teller acuity cards are used for really young children and older children who have some cognitive impairment. and they're just lined designs. And what the test does is look at how they focus on them. So they look at if they're able to shift focus. They're looking at if they're able to, what they do when they're focusing. So do they have to focus and concentrate really hard, or are they able to see and they move the card further and further away to see what the behavioral reaction is. Okay. All right, some warning signs of vision loss. If you see a child who's constantly rubbing their eyes, a lot of children who are experiencing some visual impairment get a lot of infection in their eyes. So their eyes could be itchy, or they might be trying to clear up any fog that they might be seeing or might be impacting their vision. And so you'll see them rub their eyes excessively. I've also seen children shut one eye or cover their bad eye to make their good eye see better, which is a really interesting kind of natural strategy that children develop without anyone showing them how to. If you see them having difficulty doing work or playing games close up, so if you see them pulling things to their face or pulling things to the side of their face to see, or pulling a block like this so that they can see it, you know that children who are typically developing don't usually play like that. They're able to stack blocks right in front of them without having to hold it up to see what it is. If you see those muscular weaknesses where children are going cross-eyed, or children's eyes are turning outward either simultaneously or one at a time, that infection, that red rim and crusted swollen eyelids, consistent infections can lead to some vision loss as well. Okay. These are all pretty common too. Reoccurring styes. So a stye is also an infection in the eye. If the child continues to have styes for, let's say they have 6 or 7 styes a year, the doctor might look at making sure that their vision is okay, because that can really irritate the eye itself. For older children, they might be able to tell you, you know, I feel really dizzy, or I have a headache, or I feel like I'm gonna throw up. And if you're seeing that consistently and it's not a virus, a lot of times it's their vision, because their vision impacts balance. And when you're feeling unbalanced, your body, your vestibular system makes it so that you have a physical reaction to that. That's that dizziness and that nausea. Okay, keep going. So what are the impacts of vision development or vision problems during development? So a child who's blind will likely have significant developmental delays, even with average or above average intelligence. I want you to think about how you take in information about your world as a seeing person. You look at it, right? You look and somebody says, oh, that's a tree. Do you see that tree? Do you see the leaves on that tree? And you're able to connect it visually and cognitively. So you're able to make this symbol system. Children with vision impairment aren't able to make those same connections in the same way. And so you're having to be very creative in the way that they're making those connections. And we'll look at how to do that with children. One of the biggest hindrances is the inability to play freely. Children who can see are able to explore their environment and able to see, hey, there's a drop right there on that step. I better be really careful crawling down it. But a child with vision impairment isn't going to have that same eagerness to explore, because they're going to be so cautious. They don't know what's coming next as they're exploring their environment. And so they tend to not explore as freely, which also impacts development. Okay. I'm going to keep, these are some what are called blindisms. So children who are blind, they tend to have very similar behaviors and mannerisms as they're interacting in their environment. So some of the self-stimulatory behavior is rolling the head, and a lot of times they're trying to gain balance because they feel so off balance, because they don't have their vision to support their vestibular system. A swaying of their body, so even if they're standing talking to you, they're still swaying because they're trying to get control of where they are in space. Some children will wave their fingers in front of their face almost just to test their vision, seeing where they're seeing best in that moment or where the light is. You'll also see children forcibly blinking or pressing on their eye almost to kind of like jump start it. Like, let's see if I press hard enough, if I can see just a little bit more. So those are called blindisms. Okay. Instead of that child learning the way that we were talking about, children who learn, they see something, they connect it to a word. Children who are blind or visually impaired have to use the rest of their sensations. And so as educators or as professionals, we can do things like put actual objects in their hand, and as they're feeling it, tell them, do you feel that? That's a leaf from a tree. A tree is a big pile of all these leaves. It's very tall, and then you can lift their hand up so that they're physically feeling the effects of what you are seeing as a seeing person. So you're having to give children with vision impairment a lot of different opportunities to expand their and use the senses that are still active. Okay. Keep going. What's interesting about vision impairment is although young children do show a delay initially, a lot of times they'll get caught up pretty quickly with proper intervention and catch up to their typically developing peers, and sometimes even surpass typically developing peers when they get the right support. When somebody who's worked with them at a young age knows that you have to use that touch cue, and you have to allow children to use those other sensory capacities. This one's pretty obvious to a child. We talked about how babies don't explore as often when they are blind or visually impaired. And so if you're not exploring, you're also not using your motor skills. And so motor delay is very common among children with vision problems. In fact, when I have a child who is swaying when they're walking or bumping into things a lot when they're trying to begin to walk, the first thing we do is send for a vision test just in case that's what's affecting their ability to walk. Okay. Questions so far? No? Okay, keep going. Socially, we talked about how children are passive in their exploration, but they're also passive in their interaction. Imagine not being able to see who you're talking to, not being able to see their facial expressions, not being able to see if they're enjoying the conversation or if they walked away from you. So children tend to be really passive in their interaction socially. But that support, that's when we jump in as facilitators and support interaction between children. Okay. The effects on family life, where we see this as most difficult is when a child with vision impairment is born to seeing family. Because this is just a brand new experience for the entire family. They're having to learn how to interact in a different way. They're having to change their home to be supportive for this child. It's really kind of a culture shift for the entire family. So it's a big hit, and really our responsibility to support the family as well when they have a child with a vision impairment. Okay. Sometimes with babies, what we see is parents stop interacting as much, because what's the joy for parents? You talk to a baby, and then what does the baby do? Respond, right? Smile, coo, and give you all these facial feedbacks. But with a child who is blind, a lot of parents think, well, they can't see my face, they can't see my emotions, but babies can feel that connection and that love when they're being held, when they're being spoken to. And so really supporting families and understanding that that child can still make a connection even though they're not seeing that connection. Okay. So as an early interventionist, a lot of the help that we're giving is supporting the family, because like we talked about, this family is probably brand new to the world of vision impairment. And so a lot of it is instruction for the parents, understanding the effect of vision impairment on overall development, and then looking at their environment. How do we accommodate this child in their home environment? How do we create learning experiences within the home, an environment that the child can freely explore without hurting themselves? Okay. So keep going. I love this image because it's inviting not only to a child with vision impairment, but it's inviting to all children. And so all children would be excited to kind of touch the center and use it to move along and support them in becoming mobile. And so this is actually an infant area. And so think of all the ways that this would support not only children with vision impairment, but children who are typically developing. I just love this image. Okay. When children are in center-based care, then the role it becomes, let's facilitate the social interactions. Let's make sure that children are making connections with each other. Let's make sure we're supporting typically developing children in how to engage a child with vision impairment, how to be a true friend, a true connection to this child. One of the professionals that is specific to this community is called an orientation and mobility specialist. This individual has specialized training in how to support the child in moving through their environment. So they're looking at how to feel if there's a step, how to feel when the ground changes surface texture, how to know if a door is open and closed, how to judge the space of the entrance of a doorway, how to know when somebody's right next to you or in front of you or behind you. And so it's really teaching a child how to navigate their world. Okay. Questions yet? Not yet? Okay. All right. A lot of this is the videos that I have on Canvas already, so I won't have you watch it with me right now. But what we're going to practice in class is how to support children with vision impairment. And a lot of it is that arrangement of the classroom. And we're going to do an empathy activity when we meet on Tuesday on how changing the environmental arrangement can really hinder a child's development and exploration when they just have gotten used to the environment that they've practiced in. So any sudden changes without preparation is actually really dangerous for young children. What it's important to know is that children are going to fall. And so that's something we have to be okay with. If they fall, they're learning, okay, that step was too high for me. I have to lift my leg higher. Our role is to create this safe environment to allow children to have those falls so that they're not having really severe injuries, but instead it's a learning experience. And I know it's hard. You want to catch those children and you want to make sure they don't get hurt. But if we are cradling them and coddling them, then they're not really getting a full sense of their environment. They're not learning how to be independent, because as they get older, there's not going to be somebody to catch them if they trip over the sidewalk. So we want children to get that practice of, okay, I have to lift my leg higher, or this change in floor space makes me have to put more pressure when I walk on my feet. So it's all a learning experience, okay? So some guidelines for teachers. The first thing we have to do is determine the degree of vision. So can the child see at all? What can the child see? How can the child see? Is it just out of their periphery? Is it only outlines? Is it shadows? Can they see if there's a contrasting background? So asking those questions and testing those theories in order to best support them in your program. Orientation and mobility schools are a teaching priority, so work with that orientation and mobility specialist in room arrangement, in flooring arrangement, so that the child feels supported in that environment. What I really enjoy is putting these identifying materials or subtle noisemakers on the floor, doors, and room dividers or lockers for older children, so that they know when I hear the chime, somebody's coming through the front door. When my feet go from carpet to linoleum, I know I'm now in the art area. When I move my hands from the circle table 2 feet to the right, I know I'm now in the dramatic play area. So those changes really support children in knowing where they are, which then supports independence. Okay. Also, when we're talking with children with vision impairment, we have to be very specific. If I were to tell you, hey, the slide's over there, and you have vision impairment, you can't see my finger point, you have no idea where over there is. And so it's very important to be specific. If you walk 3 steps and then you turn your body towards the light and walk 4 more steps, you're going to be at the slide. So very specific wording. Avoid there, here, or be careful, because that doesn't give the child instruction. If you see a child that's about to fall and you say, be careful, or a ball's coming towards their head and you say, be careful, they have no idea why they're being careful. So if you say, duck your head or put your head down because a ball is coming, then they have instruction. But very vague instructions aren't going to support the child. Okay. And then this is when you're going to use your vocabulary. You're going to talk about everything and anything in the environment. You're going to be descriptive because you are that child's eyes. You're going to explain to them what they're feeling and what they're interacting with. Okay. What's important too is helping children to localize and sort out sounds. Loud sounds are going to be scary, but it's important to differentiate between just loud and then dangerous. And this is a really fun game to actually play with an entire classroom of children who can see and who have visual impairment. Because you just play an audio, let's say of a vacuum cleaner, for example, and then you have to decide, is this just a loud sound or is this a dangerous sound? And then as a group, they can decide, but it's really supporting the child with vision impairment. And then you can play the sound of a lawnmower and realize, oh, that's a dangerous sound. I need to move out of the way if the lawnmower is coming. So that's an example of an auditory guessing game. Okay. All right. When you're providing opportunities to touch and teaching children about words and about things, it's important to use real objects. So if you're teaching children what an apple is, you're going to give them a real apple and not a toy apple, because then as they're feeling the plastic apple, they're going to think, oh, okay, apples feel like plastic and now I can eat them. But giving them real life experiences helps them to understand that this is a real apple, and then what I'm feeling over here is a toy. Those differentiations are very important. Okay. I'm gonna keep going. Oh, look at that, we finished. Oh, and just a couple minutes over 30 minutes. Are there any questions? No, I'm gonna go ahead and stop the recording.